Hi guys, like we said that we are doing a series on signs and symptoms in psychiatry or of psychiatry. So we did say that what makes us to classify a patient as a psychiatry patient, there are 5 things that we need to look at. We need to look at the speech, and we've spoken about the speech, abnormalities of speech. We've spoken about behavioral and psychomotor abnormalities. Now I want us to do mood and affect. Mood and affect. And then next we're gonna do psychotic symptoms. Signs and symptoms that are related to psychosis. And then we're gonna do anxiety at the end. So here we are doing mood. So guys, a mood, what is a mood? A mood is a subjective, it's a subjective description of how the patient is feeling. So it's a patient saying to you, you know, doc, I feel empty. I feel hopeless. I feel sad, worried. Na. The opposite, this is like your low mood kind of symptoms. I feel empty, I feel hopeless, I feel sad, I feel worried. They can also say, I feel happy, extremely happy, euphoric, so this is an elevated mood associated with hypomania or mania. This one is associated with depression. And then that's why now after you have told them this, they can say your mood, you've got a depressed mood. After you have told them all of this information, they say, okay, you have mania or hypomania, whatever the case might be. Or they say you are in between, so you are euthymic. Okay, that's mood. And then now it's different. Another thing, you can have a patient who has got what they call a labile mood. When you have a labile mood, it means you've got oscillations. So your mood is like this. 1 minute you are very happy, the next moment you are sad. So it's changing. That's what they call a labile mood. You can also have, this is under a low mood now, a melancholic, dysphoric, what else? Or elevated mood, ecstatic, things like that. What else am I? You can also talk of anhedonia. So anhedonia or anhedonia is someone who used to do, so it's a loss of interest in all pleasurable activities. So if you were someone who loved tennis, playing tennis, or watching a certain TV program, or you loved cooking or baking, now all those things do not make sense to you anymore. You are not doing them. You are so depressed that you don't even love the things that you used to love. So that's anhedonia. So these or you can talk of irritable, the patient has had an irritable mood, things like that. So the list goes on, guys. There are so many terms that can be used just to describe either a low mood or an elevated mood. Remember, in between is euthymia, just a normal mood. Okay, so let's move on to affect. So affect is an objective description of someone's mood. So if we can put it simpler, an affect is an expressed mood, or let's say expressed mood or expressed emotion. I think mood is even better. Expressed mood. Someone's affect can be, first of all, we talk of congruency. What is congruency? Congruency, okay, someone's mood can either be congruent or incongruent. So someone's affect can be incongruent in relation to the mood, or it can be congruent in relation to the mood. When we say someone has got a congruent affect, it means that you describe yourself as hopeless, as sad, and we can still pick that up on your affect, because your affect is the way we see you. It's the mood that you are expressing. So if you say you are sad, we expect an affect that is in line or that is congruent with you being sad. So if it's incongruent, for instance, you can't say you are hopeless, you are sad, and then the next thing when we look at you, you are smiling and laughing and happy. So it means now that's an affect that is incongruent with the mood. So that's that. But the words that are used to describe an affect is things like blunt, a flat affect, restrictive. So someone who's got a flat affect, this is like there's no expressed emotion or mood at all. There's like nothing. If it's blunt, it means it's reduced. It's there, but it's very minimal. It's just reduced. With these ones, it's flat. Or you can have an appropriate. So if you say to me, you are hopeless, you are feeling sad, you are feeling worried, and then I look at you, and then I see someone who's just sitting there, who's got psychomotor retardation. Psychomotor retardation with hopelessness, feeling sad, those are congruent. That's So what I'm saying is that if you say you are sad, you are hopeless, you feel empty, you have given me a description of someone who is depressed. Now I expect to find someone who's just sitting there feeling really hopeless, who has got psychomotor retardation. But if you say you are sad, you are hopeless, and then I see agitation, you are moving everywhere and all of that, then I start to think, what's happening? Or now when I look at you, you are smiling, you are happy, then now I look at, and then I start to say, oh, okay, now your affect is just not congruent with the mood that you have described. And it can also be appropriate. So if you are saying you are feeling sad, you are, or maybe the opposite can also be true. You say you are happy, your mood is you've got an elevated mood, and then when I look at you, you are just like this, psychomotor retardation again. Then your happy mood is not congruent with the affect that I see, which looks like an affect of someone who's depressed. That's what I'm trying to explain. So the mood and the affect can be appropriate. I say I'm depressed, and then when you look at me, I look depressed. It's like someone who says I'm a beggar. I don't have anything. I've not eaten for days, and then they come to you driving a BMW, wearing a nice suit. Then that's not congruent. Basically, just to make things simple, that's incongruent. So it can be inappropriate, can be appropriate. It can be restrictive. Basically, that's that when it comes to the affect. So just remember, there are two things that are important with the affect and the mood. Know the congruency. Is it congruent? Is it not congruent? And also try and match the affect with the said or the described mood. Are they in line? I don't expect someone who's euthymic, who's got a normal mood, when I look at them, they look teary, they've got swollen eyes, you can see that they've been crying, and yet they had a euthymic mood, or they had an elevated mood. Then that's not congruent, that's incongruent. I hope you guys get that. What else am I missing here? I don't think there's anything that I've missed. So okay guys, if I've missed anything, please comment, and let's learn together. Remember, I'm not a psychiatrist. I'm just still an intern, and there's a lot that I still need to know, still need to read, but I just happen to be someone who loves to know, someone who loves to teach. So that's me. So let's meet on the next TAT. Thank you.